Welcome back, everyone. In the previous recordings, we did, of course, talk about immune deficiencies. So when the immune system is suppressed. Now we're actually going to talk about the opposite. So we're going to talk about hypersensitivity, where the immune system is actually overactive. And we are going to start with these allergic hypersensitivity reactions. And we'll talk about immediate hypersensitivity reactions that may involve anaphylaxis. And we'll talk about delayed hypersensitivity reactions using the examples of allergic contact dermatitis and hypersensitivity pneumonitis. So in terms of detailed learning objectives, they're to be able to define the term hypersensitivity, be able to compare and contrast immediate and delayed hypersensitivity reactions in general, describe allergic hypersensitivity reactions in general, describe immediate hypersensitivity reactions including anaphylaxis, and finally describe delayed hypersensitivity reactions including allergic contact dermatitis and hypersensitivity pneumonitis. Now, hypersensitivity is an overreaction of the immune system to an antigen. If that antigen is foreign, then it's known as an allergic reaction. And if the antigen is a self-antigen, this can cause autoimmune disease. And hypersensitivity reactions often involve inflammation. Now, in your textbooks or your readings, if it mentions hypersensitivity and it doesn't actually specify that it's an autoimmune reaction, then they're usually talking about an allergic reaction. Now, inflammation can be initiated by many different mechanisms. Histamine is a chemical mediator and it does promote inflammation, but it's not the only pro-inflammatory molecule. Inflammation will be initiated by any tissue damage. It doesn't have to involve an infection. And inflammation itself can cause tissue damage, and sometimes that damage is permanent. And in this case, there will be a loss of function. It can also be local, so confined to a particular area, or it can be systemic, spread throughout the body. And when it is systemic, fever is often associated with systemic inflammation. We'll put a star on the inflammation because the next topic is actually all about inflammation, and we'll go through many of this information in more detail. So we're going to start with these allergic hypersensitivity reactions, which is overreaction of the immune system to a foreign antigen that's not normally harmful, and these are called allergens. So we're not talking about a pathogen here which would cause damage to the body. We're talking about these allergens that in some people their immune system sees them as foreign and therefore mounts an immune response to them. These allergic reactions can be caused by different mechanisms. They will have a different reaction time. Sometimes they occur within minutes, other times they take days to develop. They will also sort of vary in the time it takes for the symptoms to show. Again, that's kind of got to do with the reaction time. So sometimes the symptoms are visible straight away. Other times it takes, time for the symptoms to develop. And of course, they're also going to vary in severity as well. Exposure to the particular allergen or antigen can occur in different ways. So inhalation, so maybe inhalation of pollen in some people can trigger one of these. Ingestion, say of a peanut in some people. Skin contact, so exposure to latex and gloves or maybe some kind of plants. And injection as well. So some people do get these allergic hypersensitivity reactions say to an element of a vaccine, which thankfully is rare, but it does happen. So the symptoms then and the severity of the reaction will vary. And this kind of relates to the way you're exposed to an antigen. Say your skin is exposed to a particular antigen and that might just result in a sort of local inflammation due to that. But if you were to ingest that same antigen, then there might be a greater risk of developing a systemic reaction. And as I mentioned in some of the exposure ways, there are very common allergens, and these include pollen, dust mite feces, cat saliva, peanuts, insect stings, and also penicillin and latex. The other thing that's really important is how sensitive somebody is to a particular allergen. So say somebody is exposed to an allergen and might just cause a local reaction, but the person beside them might be exposed to that same allergen and it might cause a systemic reaction and the person then goes into shock. The other thing then that's important is the amount of allergen as well will also determine the severity of the reaction. Now, in general, the more times a person is exposed to an allergen, the worse the reaction becomes. Can you explain why? So if you just stop me now and think about that, and then play me again and we'll talk about it. So yes, I know you got it right. It's all about that primary exposure to the allergen resulting in the creation of those memory B cells and T cells, so that then on subsequent exposure to the same allergen, the immune response is going to get stronger and stronger. Now, having said that, there are times when repeated exposure to an antigen causes tolerance and the immune system no longer reacts to that antigen. So there are sort of medical procedures where somebody who does have these allergic hypersensitivity reactions, they're exposed to small amounts of the allergen to try and stimulate tolerance. And so when you do stimulate tolerance, then the body sees that allergen or antigen as normal and doesn't mount an immune reaction to it. However, in general, the more times a person is exposed to an allergen, the worse the reaction becomes. And so with these allergic hypersensitivity reactions, the responses can be very rapid or they can be very slow. With the very rapid responses, the reactions are obvious somewhere between 3 to 30 minutes after exposure. And it's for this reason that they're called immediate hypersensitivity reactions. Compare this then with the delayed hypersensitivity reactions, where the reaction is only obvious about 1 to 3 days after exposure to the antigen. The reason these reactions occur usually within minutes is because of a preformed antibody. And this antibody is an IgE antibody, and so we say that it's an IgE-mediated hypersensitivity response. And it seems to be similar to the immune response that's mounted against parasitic worms. The response involves mast cells, basophils, and eosinophils. So, how does this antibody form? Let's say somebody is exposed to a particular allergen, let's say pollen. That pollen doesn't normally stimulate an allergic reaction in some people, but they become sensitized. And when they become sensitized, they produce this IgE antibody. This IgE antibody then coats the surface of mast cells and basophils. And then on subsequent exposure to that pollen then binds kind of to neighboring antibodies, and that brings them together and they kind of wriggle around, right? And that wriggling around is enough to cause a process called degranulation. So inside this mast cell, let's say this is, there are granules, and these granules contain chemicals such as histamine, enzymes such as proteases, and also chemotactic factors. So when this mast cell sort of degranulates, it's going to release its granules. So release those chemicals, right? And we know that histamine is a pro-inflammatory chemical, and also these other things as well will also cause tissue damage. So once histamine is released into the bloodstream, then it can bind to the histamine receptor. Here we're talking about histamine receptors on inflammatory cells to then, produce the symptoms of that particular hypersensitivity reaction. Now, common allergens include pollen, house dust mite, feces, cat saliva, foods like peanuts, insect stings, and chemicals like penicillin and latex. So one of the theories is that you're less likely to have an allergic reaction if you're infected with a parasitic worm. Now, in developed countries, we're not getting parasitic worm infections as much as we used to, still more common in developing countries. Remember that the eosinophil is a white blood cell that's really important in fighting parasitic worm infections. So some people with inflammatory conditions, autoimmune conditions, such as Crohn's disease, where their own immune system is sort of destroying their digestive tract, have given themselves a parasitic worm in an attempt to keep the eosinophils busy so that they're not actually causing the destruction to their digestive tract. And there's lots of literature out there to show that this has, has an element of success in treating their inflammation from the actual autoimmune condition. So here we have a parasitic worm, and this looks like it's sort of epithelial tissue here of part of the digestive tract. And then we have these lighter colored cells that are these eosinophils, and they're sort of migrating into the area there to fight off that parasitic worm. And again, the theory is that we're not getting sufficient number of these parasitic worms, so the eosinophils then start to attack allergens that are not actually pathogens. Now, these immediate hypersensitivity reactions can be local, confined to one area, or they can be systemic. They can be just mildly annoying to fatal. So rhinitis is pretty sort of annoying, runny eyes and nose. You can also get asthma, which is an immediate hypersensitivity reaction in the airways. And also, a very serious life-threatening condition called anaphylaxis. And sort of how serious the reaction is depends upon how sensitive the individual is to an allergen, how much of the allergen they're actually exposed to, and how, they have been exposed to that allergen. As I mentioned, rhinitis is pretty, annoying, but anaphylaxis then is a systemic response resulting in systemic inflammation. What happens with anaphylaxis is there's systemic vasodilation, so blood vessels, the smooth muscle, ring of smooth muscle surrounding the blood vessel relaxes, and so that causes the blood vessels to become wider. They still have the same amount of blood in them, but they're wider. At the same time, you also get increased vascular permeability, so blood vessels become leaky, and that protein-rich fluid then can leak out and accumulate in the tissues to cause tissue swelling or tissue edema. And together this leads to a massive drop in blood pressure. Now, if this is severe enough, then blood vessels will start to collapse, and blood containing oxygen is not going to be able to be delivered to tissues, and waste products are not going to be taken away or removed, and then that results in anaphylactic shock. So anaphylaxis is a life-threatening condition, and this is why people with severe allergies carry around an EpiPen, epi for epinephrine or adrenaline. And we know that adrenaline will cause vasoconstriction and therefore reverse that vasodilation that's leading to that anaphylactic shock. And so some of the signs and symptoms then of anaphylaxis include itching, hives, and skin inflammation. This might then progress to bronchospasm and respiratory distress. So bronchospasm caused by smooth muscle cell contraction in those little tubes of the airways, vomiting and diarrhea, laryngeal edema and obstruction, and this swelling then can block the trachea. And then in, more severe cases that lead to anaphylactic shock, this occurs when vasculature or blood vessels collapse, and heart failure, where there is insufficient cardiac output then to meet the metabolic demands of the body. And so anaphylaxis is a severe type of immediate hypersensitivity reaction that can occur within seconds to minutes after exposure to a particular allergen that the person has already been sensitized to. We'll move on now and talk a little bit about delayed hypersensitivity reactions. And these are ones where the symptoms of this reaction don't appear for a day or a few days. Now, instead of being antibody mediated, these are cell mediated. So these are T cell mediated hypersensitivity reactions. It's a T helper 1 response that involves cytokines instead of a T helper 2 response involving those antibodies. The T helper 1 cells are activated by antigen presentation on the surface of a cell, and these activated T helper 1 cells then synthesize cytokines, and it's those cytokines then being those chemical mediators that stimulate inflammation. So all of this takes time, the antigen presentation, the activation of the helper cells, and also the synthesis of those cytokines. And the same response can actually be involved in transplant rejections. So when somebody gets, say, a transplanted kidney, their immune system can reject it via this same process, and also autoimmune disease, which we'll talk about shortly. And the two examples we've given you for this type of reaction is allergic contact dermatitis, so in the skin, and hypersensitivity pneumonitis in the lungs. So as I mentioned, allergic contact dermatitis is an inflammatory response in the skin. Signs and symptoms include itchiness or pruritus, and the skin appears sort of red and inflamed, so erythematous. And this also occurs with an autoimmune condition called lupus that we'll get to shortly. And the skin is bumpy or papular. Again, though, it's an allergic reaction which is caused by initial exposure to an allergen, and the person then becomes sensitized, and then this allergic reaction occurs on subsequent exposure. And common allergens then include makeup, so components of makeup, hair dyes, topical drugs, and plant oils. So there is this plant in the US called poison ivy, and it has a very sort of oily leaf. And if you rub up against it, that oil is very difficult to remove from the skin. And in some people who do become sensitized to it, that can cause this type of allergic contact dermatitis. The actual reaction might just be mild or can be very intense. If you're scratching all the time because you're itchy, that can cause a breakdown in the skin, so that anatomical barrier, and secondary infections then can develop. The problem with this allergic contact dermatitis is often identifying the antigen that's causing it can be very difficult, as it takes 12 hours or usually more than 24 hours for the symptoms to become obvious. So if you've sort of brushed up against, let's say it's that poison ivy plant when you're out walking in the bush, and then, you brush up against lots of other different things, it's difficult then to identify what actually caused the dermatitis to begin with. Now, the reaction can last weeks or days. Topical treatments are often used, so creams or tinctures or gels or something like that. But with severe cases, systemic corticosteroids can be used. So corticosteroids are steroidal anti-inflammatory drugs. And, while they're great as anti-inflammatory agents, they bring a whole pile of other issues with them. And we'll go through those when we get to the anti-inflammatory topic. Hypersensitivity pneumonitis then is a delayed hypersensitivity reaction in the lungs. So here we have inhaled antigens causing this reaction. There's activation of pulmonary T cells leading to inflammation in the lungs. It causes labored breathing, dry cough, chills and fever, headache and malaise. And, long-term low-level exposure to antigens can lead to irreversible lung disease. For example, farmer's lung from inhaling sort of fungal spores from moldy hay or breathing in sawdust particles. So here you've got, say, long level exposure. Let's concentrate on the sawdust particles entering lung tissue, and we have those macrophages that patrol the lung tissue, sort of engulfing the sawdust particles and trying to break them down, but they can't. So over time, you find this accumulation of these sawdust particles in the lungs, and then that sort of triggers chronic acute inflammation, which then becomes chronic inflammation, and that leads to that permanent or irreversible lung disease. And fungal spores actually trigger the same sort of macrophage response. So if you're playing around with moldy hay, you really should be wearing a mask.